Okay, so welcome to week 10. This is a review week. We are reviewing HESI this week in all of the lectures. So just want to be clear on a couple of things. One is everybody knows that they are invited to attend any session this week. Is that correct? Do you guys understand that? Okay, I sent out a schedule of all the sections this week. Okay, there's probably, I'd have to go back and count, but there's probably 8 or 9 sessions to go to. Okay, you do need to attend, obviously, your home lecture this week. That's the attendance for week 10. And then like we have several of Dr. Lundy's students. So they're coming to an extra session. Okay, so feel free to attend any other sessions. Okay, every professor does their review differently. For example, I already watched Dr. Lundy's review from yesterday. Okay, because I wanted to kind of see what she was covering, and we're all covering the same information, but it may be in different formats. For example, I know that Professor Apple, at the end of the week, she has done a big PowerPoint. Okay, the PowerPoint is a summary of your big study guidebook, HESI study guidebook. Same information, but in a different PowerPoint. I'm not going to go through that PowerPoint today. I have a different way to approach this, but for Professor Apple, at the end of the week, she does PowerPoint. So if you like to learn through PowerPoints, I would encourage you to attend hers. Okay, Dr. Lundy, when I watched her review, she did a lot of questions. She did a lot. She did. We're going to do some of the questions. We're going to do the critical thinking activity that she did. But as far as the practice test, HESI practice test, she covered quite a bit of that. I'm going to focus more on the study guide. So everybody has a different way of doing things. We're all providing the same information, just giving it to you in a different way, which I think is good because it gives you guys an opportunity to learn in different ways. Okay, so for my students, a couple of things. You all got, sorry, I'm just taking attendance still. You all got Dr. Lundy's recording from yesterday, correct? Okay, highly recommend you watch that. Okay, if you can't attend these live sessions of other instructors, I encourage you to watch them. Okay, Dr. Lundy's yesterday was excellent. Okay, so I would encourage you to watch that. Another question, let me back up a little bit. For all the students entering into this Zoom room that are not my students, if you could put your name in the chat, that'd be fantastic. So I can send it off to the other professors because we are taking attendance for other students during these recordings. I sent you all a link this week to a HESI practice exam. Everybody get that? Has anybody taken it? Has anybody looked at it?
I didn't take it. I wanted to go to the reviews first and then
Okay.
do it.
Okay. Well, you can take it. You can take it over and over again.
Oh, okay.
Just so you know. So actually, it might be good to take it now and then go to the reviews and see, and then do it at the end of the week. Okay. So anyway, I just want to make sure everybody got that and you're not having, has anybody accessed it yet? Anybody? Okay. Okay, any of Dr. Lundy's students accessed it yet?
Yes, I did.
And was it helpful, Laquan?
It was.
Okay. I mean, there's a reason we send that out to you. It's another tool. Okay, we're trying to give you as many tools as possible. Okay. Okay. Hang on a second. I'm just still have people coming in. Hopefully you've taken a look at the study guide before the last couple of days. If you haven't, it's probably going to be pretty overwhelming to look at 56, 58 pages all at once. However, that study guide should have a lot of it should be familiar to you. We've covered the information in there, at least the concepts and the topics in class over the last 9 weeks. Okay, and we're going to pull that up and go through it, and I'll show you how it's organized. I'm just having, so as you can see, there's a lot of people in this group, a lot of other students besides our group. So that's great. So welcome to all the other students that are not mine, because that means that you are all coming to an extra review session on top of your regular lecture. So that's fantastic. Well, welcome to everybody. For those of you that missed the first part, if you're not one of mine students, put your name and your professor in the chat. Okay, so couple of things we're going to cover. I'm going to share my screen. Does anybody have any questions? Right? Any questions? Okay. All right. Okay, let's start with, I'm going to start with, let's see. I'm going to start with an internal document. Okay. Can everybody see my screen here? Yes or no?
Yes. Yes.
Okay, so I can only see a few people. Okay, I can only see 3 students. So this is interactive. I need you to jump in, and I'm going to be asking a lot of questions. Okay, so I need this to be interactive. So this is an internal document that we did a couple of terms ago. And this was after we review, we can't share this, but we're recording. So you can go back and look at the recording and see all the information in here as well. Okay, so this was an internal document that we put together probably 2 terms ago, 3 terms ago, after reviewing HESIs. Okay, so as you know from this class, the faculty puts together exams 1, 2, and 3, but we do not put together the HESI. Okay, we have nothing to do with the HESI. So what we did was we went back and looked at a year, I think 18 months worth of HESIs, and we put this document together. Okay, so what this is trends that we saw in the HESI exam, in several HESI exams. Okay, and so I want to go through this just to show you, because a lot the study guide, you'll see all this in the study guide as well, and we're going to go through the study guide after this. Okay, so for example, like I said, these are all things these are all questions, these are all topics, these are all concepts that came up. So we're going to go through some of these, and then I'm going to ask you guys some questions. So as you can see, we have 1, 2, 3, 4, 5, 6 sections. Okay, we broke this out into 6 sections: community, vulnerable populations, disaster, child development, geriatrics, and infectious disease. Okay, this HESI, along with your NCLEX, it's very med-surg heavy focused when it comes to community, as you'll see from these topics, these trends that we saw that were covered. Okay, so let's do infectious disease. Okay, because this has a lot of information in there. Okay, so the other thing I want The other thing I want to mention is Kaplan. Does somebody have their? I need to mute somebody here. Let's see. Everybody muted. Okay. So the other thing is Kaplan. I'm jumping back because I want to remind you that Kaplan that's due this week, this is an excellent source of information as well. Kaplan is the best activity you have all term that mirrors the HESI. Okay, it actually mirrors the NCLEX as well, as far as the way the questions are asked. So pay attention to your Kaplan assignment this week. If you've already done it, I hope go back and review it. Look at the rationales. You had to remediate all 30 of the questions. So for those of you, I can't see right now because I have my screen share, just a reminder, if you haven't remediated all 30 of your questions for your Kaplan assignment this week, go back and do it, because you're not going to get credit unless you remediate all 30 questions. And those were in several announcements this week. And what's the reason we want you to remediate the questions?
Learn the rationale, why to choose that answer and learn why.
Yep. Thanks, Christina. Did everybody hear what Christina said? It's the learning that goes along with it. For my students, I always harp on rationales. Rationales are excellent learning opportunities. It's fine to have the right answer or the wrong answer, but it really helps to know why the right answer is the right answer or why the other answers are wrong. So the Kaplan, pay attention to your Kaplan remediation, take good notes. Excellent, excellent example of how you're going to be presented with the HESI, how the HESI is going to be presented to you. Okay, so, okay, so let's see. So we're on infectious disease. Okay, so all this at the beginning, this is all kind of class, topic, maternity, pediatrics, pathophysiology. But remember, we found this in community. We found these trends in the community HESI. So focused on integrating med-surg, integrating maternity, peds, pathophysiology, med-surg, skin, immune, hematology. So pay attention to these, okay? It's just not straight up community questions. The trends that we saw, they're bringing in everything actually. Okay, so what do you think they're talking about when they talk about vertical transmission for newborns? What did we learn about vertical transmission in newborns? What part of our course did we learn that was important to remember?
STDs,
Okay, and what about STDs?
the transmission from mother to baby during birth, vaginal birth.
Yep. And do we remember what in particular, what diseases we were talking about?
HIV.
Pardon me?
HIV.
Syphilis.
Thank you. Syphilis. Okay. And who said that? Mary? Okay. So Mary, just explain that a little bit further. What were we concerned about with syphilis?
It can cause the baby to go blind.
Correct. And cause very serious problems. So do we all remember that? Okay. And then let's go through vector-borne, right? So the next trend we saw was a question about a vector-borne disease. Okay. So what's vector-borne? What's vector?
Is it that comes from mosquitoes?
Yep.
A host. Mm-hmm.
Go ahead. What else besides mosquitoes? Bugs, anything that is going to bite and put any kind of disease or bacteria into you. Okay, so what do we want to know about? What are some types of vector-borne diseases?
Zika virus.
Yep. What about Lyme?
Mm-hmm.
What else?
H1N1.
Okay, good. Good. Okay. What about CDC reportable diseases? What's that talking about? What do we talk about in class with regards to CDC reportable diseases?
Tuberculosis,
Pardon me?
tuberculosis,
Tuberculosis. Yep.
TB,
TB. Yep.
anthrax,
Yep.
and
Yep.
diphtheria or something like that.
Yep. Now, remember that's exactly right. But the topic means that what we need to know is there are national, state, and local reporting guidelines, right? There's a national database for reportable diseases, and then the state may have additional ones, and then your localities may have additional ones. Okay. What do we know about next one? Now, this is bringing in pathophysiology and med surg. What do we know about endemic symptoms? What would be some endemic symptoms of possible terrorism? What would those be?
That would be like anthrax.
Okay. Yep. And what about anthrax?
The different ways that you could get it. You could get it from touching. It could be sent through the mail.
And when you have any kind of exposures, what's the first phone call we make?
CDC.
Poison control.
Mhm.
Right? This one specifically is anthrax incubation. Okay, again, look at the topic: community health, med surg question, trauma and emergency. Go back to your book and type in anthrax and pull up that section in your book and read about it. Okay, because when we were reviewing HESIs, there was questions about anthrax incubation. Okay. Okay, same with the next one. Community health, all right, community health. It's a med surg question. It has to do with respiratory, and it has to do with SARS. What do we think we need to know here? And again, I don't know the questions. We're just pulling up trends that we saw to help you organize your studying. Okay, what do we think about SARS? What is SARS?
I think are you talking about the etiology behind how it's transmitted, the host, the agent, and the environment?
Yes, yes. Well, think about SARS. What is it? Severe respiratory, right? So think about what we've learned all term. What are we focusing on? Our ABCs. What are your ABCs?
Breathing, circulation.
Okay, so what are we going to be assessing with SARS?
Your breathing, your respiratory.
Exactly. So when you think SARS, think ABCs, right? Remember the important areas we're focused on here with our HESIs, well, in our NCLEX 2 are nursing process. We need to know that back and forth, up and down, inside and out, right? We need to know our ABCs. So when it's a med surg question, it comes from the community health HESI, but it's a med surg question. We need to think ABCs. Okay. Next one, again, community health question, pathophysiology, med surg, specifically reproductive. We found that we saw that they were asking about PID risk factors. What's PID?
Pelvic inflammatory disease.
Okay, and what are the risk factors?
Infertility.
Pardon?
Multiple sex partners.
Yep. Keep going.
Yeah.
Untreated infection.
Yep. Good. Okay. Okay, next is epidemiological triad agent. What's the agent? Well, first let's step back. What are the three parts of the epidemiological triangle?
Agent, host, environment.
House and environment.
Okay, let's start with the agent. What's an agent? What is the agent?
Chemical.
What?
Or a chemical. Something about bacteria or infect, or viral infection.
Okay. Okay. What's the host?
Human.
Anything it can live off of, us.
Mhm.
People.
And environment, how does the environment play into this?
The way it's transmitted.
Mhm. Okay. So what kind of question might you get here? Epidemiological triad agent. Maybe a question about an agent. Maybe, I don't know what the question would be, but this specifically says agent. So maybe it's asking about a specific disease or specific viral, bacterial, whatever the agent is. So keep that in mind. But I wouldn't specifically focus on just agent here. You need to be familiar with what the epidemiological triangle is, all three. Okay. Why do we think they have trending flu vaccine priority? Why do we think about that? What is the flu vaccine?
Prevention.
Pardon me?
For prevention.
Right. So that was the question I was going to ask. Is a flu vaccine primary, secondary, or tertiary?
Primary.
Primary.
Why is it primary?
You try to help prevent
Before the
before it
disease-
happens.
Yeah, before it occurs.
Okay. Okay. Next is TB. You're going to get TB tested. Okay. There's questions about TB. So there's a whole section in the study guide that's TB. Okay. Okay. What about TB skin follow-up test? How long, when can you read the results?
48
to
hours.
72 hours.
What is it?
48 to 72.
Okay. And what does it need to be? What does the size need to be?
Less than 6. I think 6 centimeter.
What?
Millimeter.
Less than 6.
Duration.
6 or less.
Does
The
everybody
blood should
agree?
be 10 millimeters.
10.
It should be
Okay. What about what do they want to know about TB screening and X-ray? Why is that important?
if you've been exposed.
What's the X-ray going to show?
Whether you have infiltrates.
Okay. So there's some trends for infectious disease. Okay. Let's go to the next one. Let's go to geriatrics. Is this helpful to go through? I actually think it's helpful to go through the actual trends that we saw, because these are the topics that are coming up in HESI questions.
Yes,
Okay,
this
well,
is helpful.
Okay, let's see. Community. This is a community. These are all community. Okay, see these come up in community HESIs, but here we go again with MedSurge. MedSurge elder health assessment. Why do an elder health assessment? What are we looking for? How do you do an elder health assessment? What's involved?
You can assess for fall rates. You can assess for their needs, like if they need any needs at home. Or
And maybe he's talking about like abuse in the home or neglect or
Exactly.
misappropriation of funds and stuff like that.
Mhm. So there's lots of things to look for when you're doing an elderly health assessment, right? You're looking for environmental risks. You're looking for safety risks, abuse risks, health risks. Okay. Okay. Next is topics would be geriatrics, med surge. cardiovascular, integumentary, community senior health screening. Why? What's important here with cardiovascular, integumentary with the elders? What about skin assessment?
Assessing for their wounds and breakdown,
And why is that important?
infections.
Yep. Okay. Let's see. This one is pathophysiology, including professional issues and tying in med surge. Teaching. How important is teaching with the elderly? Skin health. Okay. So that ties in with the last topic we looked at above, but very at risk for skin breakdown. Right? Teaching is a huge part of our role in community health. Huge. Okay. Mobility, basic nursing skills, mobility, safety, home environment safety. What are they looking for in that? Why is that important? Environmental safety. What could go wrong with the
Falls,
elderly?
breaks. Safety is very important with the elderly.
Mhm. What are things you would look for in the home when you were doing an environmental assessment?
Cords, throw
Mattress
rugs,
replacement, rugs,
Heat, air condition, fans, right?
electricity in general.
Yep, food.
Mhm.
Okay. Okay. Professional issues, legal, ethical, leadership, documentation. Okay. What are the one thing we talked about there was what do you think they would be looking for there with legal, ethical, and documentation? You know, we talk about the ethical principles. What's beneficence? Remember that? Do
masks,
good,
risk,
right? What's non-malfeasance?
harm,
Do no harm.
Do no harm. Do no harm. Right? There's 3 criteria that need to be met to establish liability. Okay, do you remember what they are? That's what I'm thinking this is about here. Do you remember what they are?
That a patient-doctor relationship existed. There
there was a
was
breach.
some injury due to omission or act, and then I don't know.
Injury.
Yeah, provide reasonable service, reasonable care. Yeah.
And the actual omission or lack of injure the person,
Injuring the
right?
person.
So you have a duty to perform. You had the duty to perform. There was some kind of a breach or omission where you did it incorrectly or omitted it, didn't do it, and it did harm. Okay. Okay, why would this be important? Here, med surge focus, sensory, neurological, family assistance, ophthalmic meds. What do we need to know there? What do we think we need to know there?
Making sure they have family
Teaching.
support and they can afford their meds.
Excellent, excellent. Okay. Basic nursing skills, hygiene, safety. Oh, diabetic foot care. Why is that important?
Infections again.
What else?
They are higher rates for developing wound easily on their foot.
Exactly. Why is orthostatic hypotension? Why are they asking about that?
Falls.
Falls risk.
Okay, so what might a question be about orthostatic hypotension? What might you get?
Maybe
Or maybe
teaching
dizzy. You need to teach them to get up slowly,
slowly.
rise slowly.
Excellent, excellent. You guys are getting it. Good job. Good. Secondary prevention hypertension. What are they talking about here?
Screening.
Just training, getting like maybe the medications that you need, not medications, like things you need.
Frequent blood pressure checks.
Blood pressure checks, right? Screening. That's what secondary prevention is. So maybe what would secondary prevention look like when screening for hypertension? I don't know. Maybe remember secondary, not only is it screening, but I also refer to it as early identification and early intervention. That's what screening is. Okay, so maybe they're asking a question about you're screening at a health fair to identify potential patients that may be at risk for hypertension. Is this a primary, secondary, tertiary? Secondary.
Secondary.
What's the importance of cardiovascular disease with African Americans?
They have the highest risk.
High risk.
What?
They are the highest risk.
So maybe a question is, which population below is at highest risk for cardiovascular disease? I'm just thinking out loud at questions. We're just simply here identifying the information, the trends we've seen in past HESI questions. Okay, so I'm trying to, what am I trying to do? I'm trying to read between the lines. That's what I'm trying to do. Okay, and figure out what they're going to ask about these topics. Okay, lipid screening. Okay, this is med-surg focus question, cardiovascular, endocrine. Why is it important to screen for lipids?
To prevent a stroke from happening.
Okay,
It can cause heart issue because of the narrow the path of the blood, which can lead to stroke and other stuff.
excellent. Yep. Okay, what about, I'm skipping through these, but you can, again, you have the recording, you can go back. Why is it important to teach about the vaccines? MedImmune vaccine.
Because it helps prevent.
What are vaccines? Primary, secondary, tertiary?
Primary.
Yep. Assignments, home care. What do we think about that?
Going into their home.
Okay. Maybe what we're going to accomplish in their home, or what should we accomplish in their home? Okay, just because you're there to, this is probably comes from that home health chapter. Just because you're there to do wound care doesn't mean that you can't be assessing the whole home for everything. Environmental, safety, abuse, right? What do we talk about in class about elderly relocation? Remember the question we had in the exam, that if they are relocating, say they're moving in with their kid, what potential things might we see? Remember that question? And this was the financial abuse question.
Yeah, we're thinking financially, maybe we want to make sure the son is taking the dad home for the right intention, because he's getting something about financial benefit out of it.
That's exactly right. Excellent. Yep, that's exactly right. That we need to be mindful if that it's being done for the right reason. Okay, and then some of the wrong answers were in that question, like they feel bad, something about social, okay, that they are, have moved away from their friends. Well, that's going to happen anyway.
Mhm.
Okay. And then the other wrong answer was that they were worried about, I think, changing health insurances. Well, that's going to happen anyway. Okay. Those are part of what goes along with relocation. The concern was that it's like our student just said, that it's being done for the right reason. And it's not a potential red flag for abuse. Okay. Let's see. COPD, ADLs at home. What does that tell you? Go ahead. What does that tell you? I know what it tells me, but what does it tell
They're
you?
at a huge fall risk
Because
they need their oxygen. And then a lot of them are up going to the bathroom and they're going to fall over them cords.
Okay, good, Mary. Tertiary, let's see, med surge, musculoskeletal with a tertiary prevention. So what do we think? What do we think they're talking about here? What's tertiary?
Treatment
Treatment.
of
Like
something that's already
rehab.
happened.
So they already have something. They already
Mhm.
have a musculoskeletal issue.
So maybe rehab.
Rehab, there you go. Management of a condition, rehab, exactly. That's exactly the right answer there. All right.
I have a quick question.
Yeah, go.
So for that, if they're taking a calcium supplement for their bones and things like that, would that be secondary? That would still be tertiary.
Say that again.
If they're taking a calcium supplement to strengthen the bone, would that be like,
That what would you let your teammates answer that? What is that? If they're taking a supplement to increase their bone density,
That'd be primary.
Tertiary,
why is it tertiary?
because they already probably diagnosed with something.
They already have the musculoskeletal, right, Mary?
Yes,
Do you understand that? So
I do.
it's a treatment. It's a treatment for an already diagnosed condition. Okay. We've already talked about long-term care fall prevention. What about we're still in elderly? What about GI hepatic system, community resource, elderly? What does that mean? What could that mean? What are issues here? And what community resources might be available? What kind of issues would we identify with GI and hepatic with elderly?
Hepatitis.
Mm-hmm. What
liver
else?
failure.
What else?
You talking about like GERD and acid reflux and
Yep.
uh,
Yep.
some liver transplant patients.
Yep. And community resource here tells me that as the community nurse, as those things, whatever's identified that's GI hepatic, that we need to be resourceful, right? To our community clients and know where we would not send them, but what resources might be available to them. For example, what's Meals on Wheels?
A food program that comes to your house. It delivers.
Delivery.
Okay. Skills, nutrition, teaching, ascites. What's ascites?
Fluid in the abdominal cavity.
And so might you be teaching about a home diet,
Yes, ma'am.
a specific home diet that relates to ascites?
Yeah, like high in albumin, like high in protein to increase the albumin.
Mm-hmm. Excellent. Excellent. And then basic nursing skills, nutrition teaching the elderly about healthy diets. What risk factors would we use What risk factors might they have that we would use in our teaching? Maybe risk of choking. What else would we teach them?
Heart disease, diabetes.
Mhm.
If they're in kidney failure, it's very important to, or chronic kidney disease, let's put it that way, different stages I know, but if they're elderly and having that, it's very important to teach diet and foods to avoid, like, you know, they have phosphorus, like milk in their, you know, drinking, have milk intake and sodas and all those other things.
Exactly. Excellent. Excellent. Okay. We're doing some teaching here. Med surg, we're doing teaching primary prevention with cancer. What might that look like? Primary prevention, cancer. So what are we
Not
doing?
smoking. Teach them not to smoke and not to drink.
Signs and
Avoid
symptoms.
Smoking cessation classes, options on drugs that can help you sit down away from smoking easily.
How long are they in the sun for, like exposure to sun for skin cancer? After
So-
apply sunscreen and things like that.
Prevention, teaching, right? We want to prevent it before it happens. Okay. Okay, let's jump to child development. Okay, so here's some trends we saw with child development, screening programs. Okay, remember we're talking kids. So we're talking this again, we built this 56-page study guide on these trends. Okay, so what kinds of screening programs are we talking about with regards to child development?
They get their yearly assessments.
Yep. From the doctor, what other kinds of screening programs do we do with kids?
Scoliosis.
Yeah, scoliosis.
Okay, and that's in here, scoliosis. What's scoliosis?
As curvature of the spine.
Curvature of the spine.
How do you screen for it?
You
They bend
bend
over and touch their
down
toes.
and walk your hands up the middle of their spine to check.
Scoliosis is actually in here. It's in here, so we'll get to that. Okay, basic nursing, teaching, diet, and stress. With child development, we could be talking in the study guide. We have an infant section, a child section, adolescent section. So, what's important with teaching with regards to diet and stress with kids?
Overeating.
Diet help with our growth and development.
Okay. What about stress? We talked about this in class about health education programs with kids to minimize risks and stress and how to.
Is that for suicide rates and violence, basically? To reduce violence. So the earlier we teach them how to manage their stress and anger, will reduce violence.
Yep. And these next three, heart healthy diet, but 6 and 7 talk about how do we teach in the pre-adolescent teaching? How do we teach with adolescents? That's in the study guide. I'll show you where that is in the study guide. Teaching primary prevention with adolescents. What's that going to look like? What are the issues with adolescents that we want to teach ahead of time?
Suicide, car accidents, things like that.
Seatbelt safety. Okay. Well, here's seatbelt safety right here, number 10. Okay. What are they talking about with regards to neighborhood safe houses? What's that?
If they feel unsafe in their home, it's somewhere they can go.
Okay. Nicotine. Whoops. Hang on, sorry. Why are we, oh boy, what did I do here? Why are we teaching about nicotine?
They're using vapes now.
Smoking.
Mhm.
Oh, okay. Mhm.
Why are we teaching about lice? What would be, why would it be important to teach about lice? Maybe work with the parents?
Yeah.
You'll have to teach how to get rid of it and
Yep.
what to look for to find it.
Okay, what about skin health? What do we think we're talking about when it regards to child development?
Acne.
Acne. Yep. Yep. Okay. Whoops. What about immunizations, immunization rates? Why is that coming up? What are immunizations? I mean, I don't mean what are immunizations. I mean, what immunizations are important?
Yeah.
Okay, this is in the schools. This is in a
Yeah,
school.
because that if we can, if kids are not did not get the immunization, they may not be able to go to school.
Mhm.
Because
Like the flu vaccine is easier now because they're taking them to the school to get them and it's
Mhm.
much easy accessible.
Mhm. Yep. Yep. We found an actual question about the hepatovax B allergy, allergic reaction. So I think this is in the study guide, but we need to, I would suggest we know what an allergic reaction is, what it looks like to the hepatovax. Anybody looked at that yet?
Mm-mm.
Let's look at that. Everybody know about conjunctivitis?
Mm-hmm.
What do we know about that?
It's easily
It's
spread.
either-
Okay. Treatment?
Eye antibiotics.
Good hand washing,
Mhm.
don't touch the eye, spread easily that way.
Okay. And here this comes up again, family assistance with ophthalmic medication. What is that about?
Teaching.
Making sure the family knows how to use it in case the elderly cannot do it themselves. They need the proper way to use it.
Okay. And that they can afford it. Okay. And the last section here was lead poisoning. What's the prevalence? Why is lead poisoning and prevalence of important?
It affects the children's behavior,
Mhm.
and it was found in paint.
Mhm. And how do you teach about lead poisoning?
have to remove it and get a new paint.
Mhm.
About the signs and symptoms.
Look
Okay.
at houses that had it, like that were built in certain years has it.
Okay. Good. Disaster. We're going to jump to disaster now. Okay. Natural disaster preparedness. What's that about?
This getting your kid ready and alerting the community.
Okay.
On disaster.
Having an emergency bag.
Okay.
Checking it every 6 months to make sure it's not expired.
Right.
Making
Okay.
sure everybody know where it's located.
Yep.
Everybody know how to turn off the utilities.
Mm-hmm. Okay. Cholera. Why are they asking about cholera with regards to a disaster?
Because of the water shut off.
What's cholera?
think it's a disease spread by water, contaminated water.
Yep. Very important to understand about cholera because that's one of the first, it's one of the first outbreaks you're going to see. Okay. Disaster red tag triage. What does that mean? There's
How
a
to
Treat and who not to treat.
You assess them. Yeah, you're basically putting them on with the color, coordinating that as far as what's emergency at that time, and just basically you're prioritizing your care.
Yep. So know your tags. And if you have to go back into the disaster chapter to find that out, what the red tag is, but know all your tags. Okay. And then we talked about the endemic symptoms, possible terrorism. Okay. Vulnerable populations. Okay. Homelessness, cold exposure. Why is that a risk?
Hypothermia.
Yep. What other cold exposure risks do they have? Homeless.
Pneumonia.
Mhm. Frostbite.
Frostbite.
What about the migrant workers?
Pesticides.
What are their risks?
Pesticide
Was
poison.
it a pesticide poisoning?
Okay. Yep, exactly. Okay. We need to know our community resources in the rural area. Might they be a little bit more limited than the urban area?
Yes.
What might your community resources look like in the rural area?
Transportation issues.
Mhm. Okay. And then we've talked about this, the cultural, spiritual documentation with Hispanic population, right? I'm going to stop sharing for 1 sec. I'll be right back. 1 sec. Okay, sorry about that. Okay, so cultural here, the trends that we found that we're asking about were cultural, Islamic, faith as well. What's culturally sensitive teaching? What is that all about? Cultural competence. Okay, and why is it important that we are able to be culturally competent and culturally sensitive when we're teaching? Why was that whole chapter important? Why is
Careful
cultural?
not to offend someone.
Mhm.
Understanding somebody's culture help you give them the best care as well.
Mhm. Mhm. Yep. Okay. How do we, this next one is quite wordy. It's psychiatric, mental health, professional issues. Okay. Anxiety, communications, abuse, legal, ethical. Why are they, what's important to know about battering communication? What does that mean? It means we're dealing with a victim of what? Domestic violence. And how do we communicate with those? Why is it important to be sensitive on how to communicate with those types of clients?
To
We
make
don't
sure
want,
you don't antagonize
Mhm.
and
We
place
don't want to
blame
be
on the patient.
judgmental.
Yep.
Right? What about the home? Depression, grief, home health, your dying client. That's all about hospice. What's hospice?
Making sure the person is comfortable, educating somebody through the process.
Right? Hospice is palliative care, right?
It's for care for the family and the patient.
Yep, exactly. We went through this geriatric home nutrition. I'm thinking this here, psychiatric, mental health, abuse, health department visit with your pediatric patients. This, I'm thinking this is how to identify child abuse, child neglect, right? That's what I'm thinking there. And then the last topic was community. Exam question specialty area in the topic community. So what's a community assessment and why is it important?
Know what your community needs. You need to know what it has and what it doesn't have.
Mhm. Okay, and what's, again, what's the nurse's role in the community setting? Remember, that goes back to, are we community based? Are we community oriented? You know, if we're community oriented, we may be more towards the public health nurse that's assessing the community as a whole. What does the community need? What is the risks? What are the benefits? And then we also may be community based, right? And what is based? I mean, we're based in the community. We're already working in the community, right? There's a difference. There's community oriented nursing and community based nursing. Guys, remember learning about that? Okay, why is it important? Why are they talking about assessing income? What do we know? What do we know about income status in the community? If you're in poverty, what does that affect?
It affects your mode of getting the healthcare you need. Sorry, I can't talk.
It affects everything. Remember, we talked about what is the greatest factor to assess with regards to the health of an individual, a family, a community? Financial health, financial stability.
Because they can't afford their medicine. They may not have insurance.
Yeah, absolutely. That's one example. I
They
mean,
just may not even know how to go about getting insurance.
right.
Or
Assessing
they
income.
can't eat healthy because they can't afford healthy food.
Exactly. So what other, if you assess an income to be at a poverty level, what might families be struggling with? Education, food, clothing,
Home,
healthcare,
if they are homegrown,
what?
homes, like
Yeah.
they may not have a home because they don't have.
Yes. Community clinic financing. I'm thinking that's maybe insurance. How do we clinic financing and how do they pay their bills? How do they health bills? How do they Medicaid, Medicare, right? All about knowing what community resources they may need. Okay, guys, remember what's an eco-map? What's an eco-map? Remember, eco-map is the relationships, right? The relationships with the community. Do you have relationships with sports teams, with churches, it's your social relationships in the community, right? Program goal setting. What if you're putting together a goal for, if you're putting together a program, what's the first thing that you need to do?
Needs assessment.
Right. And after your needs assessment, then you can start to set your goals, right? Because you have no idea what you're doing.
Yes.
Until you do your assessment.
Yes.
Right? Community health, endocrine, really important in community. Outcome evaluation. What might they be looking at? Endocrine. What's big?
Diabetes.
Okay, outcome evaluation. I'm thinking this.
Making sure they know how to use the monitors and everything.
Outcome evaluation, I'm thinking this has everything to do with diabetes, but making sure outcome evaluation, can they care for themselves? Right? We talked about community health, risk findings. We talked about that. That's part of our assessment. Okay. Number 14, blood pressure screening, healthy people. Blood pressure screening, healthy people. What is blood pressure screening? Primary, secondary, tertiary?
Secondary.
Why?
It's a screen.
Okay. Okay, here's a med-surg question. Med-surg trend, cardiovascular, exercise, hydration. What's that about? I'm thinking it's probably teaching heart health, exercise health, hydration health to keep your cardiovascular system healthy. That's what I'm thinking there. Anybody have any additional thoughts? Last one, what about basic nursing skills, safety, leadership? What does radiation exposure look like? Where can you get exposed to radiation? What does it look like? What do you guys think a question might be there?
For the nurse wearing tracking badges, treating patients with radiation.
Time distance shield.
Chemotherapy.
Excellent. All right, so that's that internal document. Does that help to go through it? I'm gonna stop and share. Does that help to go through that? Those are trends, current trends. For all of you that joined us late, a couple things. One is if you're not my student, put your name in the chat, please. So I can let the other professors know who came. And that's number one. And number two, I just lost my train of thought. Oh, for all of you that came late, the document we just went through is an internal document that the faculty put together maybe 2 or 3 terms ago. We actually reviewed prior HESIs. Okay, not that it's probably in the last couple of years, reviewed the HESIs and came up with that document to help you maybe target your studying for the HESI into different trends. And we broke them out in all those sections: community, child development, infectious disease. So if you came late, go back and look at that beginning of the recording and see what you missed, because I think that document is actual review of previous HESIs. We don't know the questions, but we know the topics, we know the trends, we know that this topic was asked about. Don't know the specific question, but they asked a question about scoliosis. They asked a question about an allergic reaction to the Hepatovax vaccine. They asked a question about whatever, although all we just went through. Make sense? So now I just want to show you how the study guide is broken out. I'm not going to go through this. You're going to go through this. The reason I give this, I probably didn't share, did I? So let me go back. Let me share my screen. There we go. Okay, so there's a reason why we give you this study guide in the first couple of weeks. All right. I tell my students that I would like it to be a whole term study guide. Okay, that every couple of weeks you should take a look at this and not X out, but check off the sections that we've gone through in class. Okay. This long study guide is a combination of the document we just reviewed, right? The community, the trends from previous HESIs, and it's also a combination of your 3 study guides, exam 1, 2, and 3. Okay, so this isn't new information. I mean, this is just a really big summary of the entire class, actually. Okay, so if you're just looking at it in the last week or, 2-3 days, it's going to look overwhelming. But know that what's in here, we've got, not necessarily we've gone through every word in this, but we've gone through these concepts. We've gone through these topics. Okay. So let's see. I'm going to go through this first page because I think this is important, but, and then I'll show you how it is structured. So it's not an all-inclusive study guide, right? Questions are randomly selected, much like NCLEX. All right. So it's really hard to predict what kind of questions are going to be on the exam. However, I hope I've made it a little bit easier to hone in to kind of target your studying on that internal document we just went through that looked at previous HESIs and previous topics and trends. Okay, so attending the live sessions, interacting with your instructors, and doing the work has prepared you for the HESI. And again, for those of you that came in late, anything you can get your hands on that has rationales, I'm a firm believer of. And first and foremost is your Kaplan assignment due this week. Please pay attention that you have to remediate all your questions. And the reason we want you to remediate is because you get rationales and you get a lot of learning out of that, even if you got the question right. Okay. Other rationales that you can go back and look at are all the case studies, at least for my students, that I sent you every week to go along with the PowerPoints. Go back and look at those case studies. They all have excellent, excellent rationales. Okay. We don't have interactive lessons. Review PowerPoints. Yeah, you know, I would stick to this study guide. I would pull out your other 3 study guides from exam 1, 2, and 3. Okay. So review your PowerPoint. Yeah. If you need additional information, I just don't, you know, use PowerPoints for me as a secondary. You should have been reviewing PowerPoints all the way through. And so I don't really see a need to go back and look at every one page for page. But if we reviewed a trend today in that internal document that you're like, I need more information on that. I need to read up on that. Okay, go back to your PowerPoints, go back to your chapter, go back to the book. Just type in the section or topic you want, and it will take you right to the book where it is. Okay, review your exam study guides. We talked about that. Your NCLEX questions, your evolved case studies have prepared you. Your discussion posts have prepped you. Okay, Kaplan questions for community is good practice. Make sure you're taking good notes during remediation. Rationales, again, rationales are super helpful. Okay, if you reviewed your exams with your instructor when the review period was open, you should have an idea of what to expect. Okay, and this is in yellow for a reason. Remember to apply your principles of clinical judgment. I can't say this enough. This community HESI is also med-surg focused. So you're going to be bringing all your med-surg skills. Look at all the different topics we just identified in the trending document. Okay, clinical judgment, nursing process, med-surg principles, safety, delegation. Okay, one of the things I said about the nursing process all the way through this class is the nursing process stays the same. It's still your ADPI, whether you're doing med-surg, whether you're doing maternity, whether you're doing peds, whether you're doing community, your ADPI is still the same. You just have to be able to apply it to the different areas of nursing that we're looking at. Okay, so ADPI is going to look very different when assessing a pediatric patient in your ER versus doing a community assessment or doing a family assessment in the home. Okay, the ADPI is the same, but it looks different. Does that make sense? I don't mean, it's the same, your ADPI, but you have to be able to, an assessment of a pediatric patient in the ER is going to look different than assessment of a family assessment you're doing in the home. Make sense? Okay, so this is separated out. I think there's 10 topics. Okay, the yellow highlight of the red is the start of a new topic, the start of a new section. Okay, so first section, population groups across the lifespan. Okay, here's infants, children, right? Adolescents, suicide, acute illness. So it's different types of populations. Okay, populations across the lifespan. So we have our kids, right, at the different breakout, and then we have our women's health issues, right? Then we have our men's health issues. Okay, elderly, again, this section is population over the lifespan. So these are all the different sections. Okay, and then we have some general information about US healthcare problems. So this is, again, general information with regards to all the different populations. Okay, this is excellent. This gives, again, populations across the lifespan. We're still in this section. Okay, here's an excellent summary on page 7 on levels of prevention with regards to populations across the lifespan. Okay. This I love at the top of page 8. Okay, this is pulled right from the book. What are your levels of prevention related to public health? And this is an excellent summary. Health education programs, secondary, screenings, tertiary, diabetic clinics. Okay, so have a look at that on page 8. And then our next section is specialty nursing. What did we cover? We covered the school nurse. We covered the faith-based nurse, right? We covered hospice. This actually should be hospice, home care, home health, right? Because that was the chapter we did, right? So hospice, home health. Okay. So those are the that's the section 2 is specialty nursing, school nurse, faith nurse, hospice, home health. Okay. The role of the nurse, that's our third section. Okay. Okay, so the role of the nurse, we're doing assessments, right? Family assessment. Here's your eco map. Again, this is, we developed this study guide based on the trends document that we just shared with you. I just shared with you. Eco map. What's an eco map? Right? What's a geogram? So this should be a review for you guys. I know it's not in the exact language you may have been presented, but these topics have been presented to you. What are some prevention strategies for violence? Okay, remember we're in the section of the nurse's role. Okay, what's our role in the nursing process? What's our role in ADPI? You know, how does ADPI look when we're looking at prevention strategies for violence? Okay, so what's the nurse's role in prevention of violence at the individual and family levels, at the community level? Looks like this is one. So we've broken this out into 4 topics. The nurse's role. Okay. Second was family assessment. What's our role in family assessment? What's our role in prevention strategies for violence? And then what's our role when working with vulnerable populations? Okay, so here's our assess from the trend document. Here's our assess, what did it say? Assess income. Okay, here's our vulnerable populations, poverty, assess incomes right here. Gives you a page number. Socioeconomic status is inversely related to mortality and morbidity for almost every disease. Okay, poor Americans with an income below the poverty level have a mortality rate nearly 3 times that of middle Americans. Okay, and here's this whole section we just talked about. Well, assessing incomes. There you go. Okay, so historically, the link between poor health and socioeconomic status resulted from housing, malnutrition, inadequate sanitation, hazardous occupations. We went through all that. Okay, so have a look at that. Okay. Okay. Legal and ethical issues. That was all over the trend document. Okay. And again, I believe we're still in the role of the nurse. Here's your negligent scope of practice. Okay. Here's your ethical principles that we need to abide by. What are they? Here they are right here. The 4 of them: respect for autonomy, non-malfeasance, beneficence, distributive justice. I know those are 4. Yeah, I know you've heard of those before. We studied those. Okay. And then professional tips. And we give you where to find them if you need to review them, but I think just reviewing them on here is fine. Tips for action. How do we become involved? Okay, the next section is program management process, right? And the first sentence under this is the program management process is like the nursing process. This one is applied to a program. Okay. Okay, so what's the process for program management? Program outcomes. Here's another nice section on primary, secondary, tertiary. You are going to get asked about primary, secondary, tertiary on this HESI. It's all over the HESI. You have to have an understanding of them. And remember, I told this to my class, I think after the second exam, don't get tripped up with education only being primary, okay? Education at the primary level is to prevent, right? But you may have education at the tertiary level as well. Let's say you have a client with diabetes, okay? You're still educating them on how to care for themselves with diabetes. So don't get tripped up on that education word and think it only applies to primary. It actually applies to primary, secondary, and tertiary. Does that make sense? Maybe in primary, you think about it as education to prevent. Maybe in tertiary, you think about education to care for whatever is going on. Right? And education is secondary. Remember, you're early identifying, early treatment. You're trying to prevent it from going any further. So education to minimize any further damage or further kind of early intervention, or early identification, early intervention. Okay, so if you've identified a potential students that are potential for at risk for obesity, you can and they're already, you've screened them and they're already kind of at risk, maybe a little bit on their way. You may be educating them on how to stop the process then, right? Early intervention. So my point is education is provided at every level. Okay, so don't get tripped up when you see the word education and only apply it to primary. Okay, and this is good. I like this. Primary, to prevent disease and promote health. Right? Secondary includes diagnosis and treatment, screening. Tertiary is a rehabilitation and return the patient to a status of maximum usefulness. You're trying to get them back to being as independent as they could be, as they can be. Okay. And then here's your aspects of program evaluation. What's important? What's important to evaluate with regards to program outcomes? All these. I would know these: relevance, adequacy, progress, efficiency, effectiveness, impact, and sustainability. Then how do you evaluate your outcomes? Okay. Next topic is infectious disease. We just went through this. Agent, host environment. Okay. So you can review that. Here's that CDC reportable disease. That was in one of the trend lines under infectious disease. Exposure to respiratory infections. That was in one of the trend lines. And here's all that information about TB. Okay, they cover TB extensively in the HESI. Okay, so this whole section is about TB, how to do a skin test, how to interpret the test. Okay. Here's your definitions of endemic and epidemic. That was covered in the trend document. Modes of transmission. We talked about the STD issues with transplacental transmission. Okay. And then here's a whole section on anthrax. Okay, this was on our trend document as well. Types of anthrax. How do you treat it? Here's your radiation exposure. That's on your trend document. Okay. So everything connects, the dots connect. Does that make sense? These aren't, the trend document and this document aren't two separate documents. You can probably see how we developed this study guide from that trend document, right? You guys following me?
Yes.
Okay, disasters. Next section, preparedness, role of the nurse. Okay. Excellent section. So have a look at that. Straightforward. Okay. American Red Cross. A lot of information on that was covered on the HESI as well. So I don't know what they're going to ask about American Red Cross. Maybe what services do they provide? How do they classify disasters? Is it single family, local, state, major disaster? What's the national response plan? Role of the nurse. Okay. So have a look at that. This is I would read through the disaster section, but this right here on page 34, review of disaster nursing, is an excellent section to, it's a review. It's kind of like a question answer of disaster nursing. Okay, so have a look at that. And here's your cholera. Information about cholera right here. Okay, and here's your tags. Okay. So both of the documents go together. Next section is culture.
Ms. Marvel, are these documents in the announcement session?
No, no, the trending document is this one. This is an internal document used by the faculty. Now I've gone through the whole document, so it's in the recording, but we can't share this document, but this is what I'm referring to. So it was the exam question, specialty area and topic. Okay. And we went through all these down here: community, vulnerable populations, disaster, child development, geriatrics, and infectious disease.
Okay.
Okay. So does that make sense? So
Yeah.
you're seeing, we went through, there's a reason why I went through that trend document, because I wanted to show you what the topics were, and then, review this study guide and show you that all those trending topics we just identified are all in your study guide.
But we
Okay.
have the study guide, right?
You should. I hope so. I mean, I sent it out the second week. I sent it out early on in the term, so that students can be reviewing it all the way through the term.
Okay. Thank you.
Yep. So there's your culture. This is excellent. This culture section in here is excellent. 3 stages of developing cultural competence. What is your competence model? You need to have awareness, you need to have knowledge, you need to have skill, cultural encounter, a cultural desire. Okay. And then there's one last, I think this is the last section, rural versus urban. What's urban? What's a suburb? What are the definitions of rural versus urban? What are the risks, the higher risks of rural residents? All right, so women's health is a higher risk in the rural areas. Health of children is a higher risk in the rural areas. Mental health, this section, even though it says rural versus urban, focuses mostly on rural because we focused a couple of chapters on that in the book. Mental health risk factors, occupational and environmental risk factors. Okay. Here's migrant farm workers. Here's a summary of all of that. So then the last section is federal agencies. Okay. So many federal health agencies are involved in governmental healthcare functions. So meaning many federal agencies are involved and help guide our practice in public health, community public health. Big one is obviously the HHS, Human Health and Human Services, and then a few other agencies within Health and Human Services that we need to know about are these two. Okay. Here's a nice little box we took from the book about OSHA. Remember OSHA and NEOSH? Okay, they're involved with occupational health and safety, right? Workplace. And then voluntary, this was in your trending document. What are voluntary and private agencies? Okay, so there's that section. Okay, so I don't know how many sections we did. I think there's 10 in the study guide, but a lot of that information, if you followed closely when we went through that trending document, it's all in the study guide. Did you guys pick up on that?
Yes.
Okay, I know we only have a few more, 20 more minutes. I want to go through one other document with you. Here's that PowerPoint that I talked about at the beginning. It's 58 slides. I can't share it with you. It's Professor Apple's, but she's going to use this on, I think, Friday when she does her review. So if you want to learn, if you want to go through the study guide that I just went through in its original version, she's going to go through it in a PowerPoint. Okay, so that would be great. Now there's one document, where is it? I want to go through with you. Okay. Whoops. I need to share my screen first. Okay, so midway through the term, I sent at least my students a whole bunch of test taking tutorials that I got from Elsevier. Okay, I sent out critical thinking. I sent out probably 9 or 10 test taking documents. My students, do you guys remember that?
Yes.
Okay, there was math, there was critical thinking, there was, oh, where's my list? There was just a whole bunch of resources I pulled from Elsevier for you guys. Okay, I want to pull back one of these, okay? And I want to go through it with you guys. Okay. So this is critical thinking fundamentals, some practice questions. Okay. Oh, no. Let me share my screen. I can't seem to remember to do that. Oh, share. Okay. Okay. So this came from Elsevier. Let's just review this. Okay. This is how to look at questions, how to answer questions, what's important, how to prioritize. Okay. So critical thinking fundamentals, practice questions. Okay. Section contains 10 practice questions at the fundamentals level. HESI hints are included to help you think through each question. Rationales are included to help you complete the thinking process. Okay. So before we read the question, here's your HESI hints. Okay, and they're pretty much the same for each question. Okay, first of all, does the question have a positive or negative focus? Okay, positive means you're implementing an intervention. Okay, so that's what the first thing you need to try and look at is, does the question have a positive or negative focus? If you're implementing an intervention, that typically means positive. Okay, what are the key words in the question? Okay, this question, the key words are dysphagia, choking, or coughing. And we'll read through the question. Okay, try and rephrase the question now that you've picked out the key words. What should the nurse do when a dysphagia client is choking and coughing? And then the fourth helpful hint is try and rule out rule out some answers. Okay, so let's go through this. A male client with dysphagia is eating lunch in the dining room of a long-term care facility. The nurse observes that the client is choking and coughing excessively while eating. Which nursing intervention should the client implement? Okay, so is this a positive or negative? Well, what does the last part of this say?
Implement.
What intervention should the nurse implement? Well, if you're implementing an intervention, what is it going to be?
Positive.
Positive. Okay. What are the key words in this question? What is dysphagia?
They have issues swallowing.
Swallowing. Yeah. So we pulled out dysphagia, choking, coughing. Okay. So what should the nurse do when the dysphagia client is choking and coughing? So what's the answer? Is it A? Do I still have anybody on here?
B,
B.
B. Why is it B?
It's B.
because he's coughing, so he's still breathing. He doesn't need the intervention yet. And with the tilt of his chin, it can reduce the symptoms because
But
he
what-
does have the trouble swallowing.
Okay.
C.
Yep. Okay, but read B again. Which way you're tilting his chin, is that correct?
No.
No, it should be
No.
down.
Should be
Okay,
down.
so B's out. So hang on. So B, we can already throw B out. I'm looking at rule out options. Okay. Why can we rule A out?
Because it says to feed him
She's-
quickly.
Yeah, he's already having issues. Why would you feed him quicker now?
And you wouldn't take him to the room.
Yeah, so A's out, B's out because we know that
Tilt down.
tilt down. Okay, so we already have 2 gone. That's great. What about C? What's C?
C
Why
is
could-
right.
Okay, why?
Because he's in the dining room with a whole bunch of people.
And maybe
there's the-
moving him to a quieter environment may calm him down a little bit.
Right. It'll calm him down and help him to concentrate on what he's doing. Because it
Okay.
says it's excessively noisy and everything else in there.
Okay, so do we
It's
agree
funny.
that C is the right answer? Yes? No?
Yes.
What? Okay, let's
I actually got that question on the exam, and I got that wrong.
Oh, okay. Okay, so the correct answer C, transport the client to a quiet environment to finish eating his meal. And then look at the rationale. The client is experiencing, and at least my students have access, you should all have access to this, but my students, I'm going to ask you to go back and read the rationales because I want to cover the 10 questions. Okay, and what I should really do, hang on, what I should really do, I'm not tech savvy. If I take this and copy it and put it in the chat, will everybody get it?
Mhm.
Yes? Would you, for the students that are not mine, would you like me to do that? Is that how you do
Yes,
it?
please.
Yes,
Okay.
please.
All right, hang on. Copy. I'm not tech savvy, so I have to stop sharing, right? All right, so let me put this in the chat. I always have to ask for help with these kinds of things to everyone. So just paste this. Is that right? So now you guys have this, right? Did I do it right?
Yeah.
Okay, so everybody has this now. Okay, so then you can go back and read the rationale. All right, I'm not going to go through the rationales. I'm going to, if you want some additional teaching and additional learning activity, you can go back and read the rationales. We're just looking at how to do questions. Okay. Number 2, the nurse assesses that a client's radial pulse volume is 1+ on a scale of 0 to 4. What action should the nurse take to most accurately count the client's pulse? Okay, again, hints. Does the question have a positive or negative focus? So a positive question would be, you're asking, what should the nurse's action be? So that's positive. What are the key words? Pulse volume 1+, accurately count rate. Rephrase, maybe you would then, when you pull out the keywords, ask, what is the most accurate way to count a pulse of someone with a weak pulse? Okay, and then rule out D. We can apparently rule out D immediately because it's not related to counting a pulse. So what's the correct answer here?
B?
Pardon me?
Is it B?
The correct answer is B. Why?
Because the apical pulse is your most accurate.
Does everybody understand that? Okay, let's read why. Well, you guys can read the rationale. Read the rationale. Okay, does that make sense? Okay, so again, I really, these rationales they tell you why it's right and why the others are not. Okay. Let's go to the next one. An ambulatory female who is alert and oriented refuses to take a shower because she's experiencing menstrual bleeding, but states she would like the nurse to assist her with a bed bath. What action should the nurse implement first? Is this positive or negative? Well, it's positive because what is the first action that she should take? That's a positive focus. You're performing a nursing action. What are some key words to pull out? Well, she's ambulatory, she's alert, she's oriented, and she refuses due to menstruation. Kind of important. Okay, so if we're rephrasing the question, what is best to do for an alert ambulatory client who refuses a shower? Okay, and it looks like we can rule out C right off the bat. Generally, some action should be taken before documenting a situation that warrants a nursing intervention, right? So if we look at C, document the client's refusal to take a shower. Well, we haven't tried anything. Okay, so yeah, C's out. Okay, what do you guys, what's the right answer? And why are the others not correct?
I would think A.
D.
Why A and why C?
D, not C.
D, I'm sorry. Did somebody say A? Why A?
Because that's what she wants. And the only thing against D, I would say we wouldn't instruct her, we would educate her. Instruct seems more like we're making her do it.
Okay. The answer is D. I think A is not going to be correct, right? Because I was thinking this, at this point, the needed equipment could be obtained, whether including any additional pads. Okay. So D is correct because we want to make sure she knows about whether you're instructing her, educating her, teaching her, right? She needs to know the benefits of showering.
I think in that particular answer, the word instruct could be easily interchanged with educate, because you're not instructing her to
Right.
take a shower, you're instructing her
And the
regarding
benefits.
the benefits. Yeah.
Yeah,
Mhm.
because it's her right to refuse. So,
Sure.
yeah.
Right. And after we teach, instruct, coach, whatever word you want to use about the benefits of showering, she still has the opportunity to make her own decision.
Okay.
Right?
Yes.
Okay, again, take a look at the rationale. Okay, which situation warrants the nurse's most immediate attention? Okay, the client, most immediate attention is positive. Okay, keywords. What's the key word coming out of here? Most immediate. This is a priority question. Okay, what are some other words to look for if you have a priority question? What would be some other words? What? No, take a step back from this question. Well, I'm asking a general question. What would be some words that you
First.
would look at if it's a priority question?
First.
First.
Last,
Most important.
most
Immediate.
important, priority. What's the top priority? What else? Do you understand what a priority question is? So all the answers may look correct, but the question may be asking, what's the priority? Or like this question, what's the most immediate? So what's the priority? Okay. So if you were going to rephrase the question, after reading it, you may say, which situation is the most critical to the client's well-being? Which client is at greatest risk of loss of physiologic integrity? Which client is not in a safe situation? Those are ways to think, rephrase it in your head after reading it. Okay. We know we can rule out C and we know we can rule out D. So these are hints. So I'd be trying to rule out answers to make it easier to select the correct answer. So right off the bat, we can rule out C. Okay, an IV obstruction of D5W is not critical. An infiltration of normal saline is not critical. Okay, so we've ruled out 2. So now we only have 2 to choose from. What's the right answer?
A,
Why?
because they're in anaphylaxis,
Correct.
be their breathing.
Correct. And anaphylaxis is going to affect what? Your ABCs. Right? I mean, B, yes, that's a problem, but we can reassess, right? We can reassess the dose. Do we need a higher dose? Do we need a different medication? 1 second. Does that make sense? B, we can reevaluate, but A is the priority, right? B, and here's your rationale. ABCs. It's a safety question, right? So I mean, I like these hints. These helpful hints. You know, if you follow these, especially the keywords, and then you can rephrase it in your own mind. And then what can we rule out? I think these are excellent strategies. And remember that going back to this document, it's called Critical Thinking Fundamentals. Okay, so these are critical thinking fundamentals that we should be thinking with each question. The nurse is observing a mother administering eye drops to her 2-year-old. Which action by the mother indicates the need for reteaching the skill? So what do you know from reading that question? She's probably doing it wrong, or she probably isn't using the correct technique. Okay, so I'm just rephrasing it in my mind. What are the correct steps to administer eye drops? And which of these steps is incorrect? Okay, and we can rule out A, B, and D right away because these are all effective, meaning doing it correctly, right? So A, that's a correct technique. B, that's a correct technique. D, the mother praises the child for good behavior. That's a correct technique. So by default, what's the correct answer?
C,
Why?
because you don't place pressure over the eyelid, you place it over the corner of it.
In this question, you can eliminate 3 answers. So by process of elimination, there's only one correct answer. Does that make sense?
Mm-hmm.
So I don't know if this is helpful. I'm just trying to go over some basic tips. You all may know all this, but I just would like to review it with you. Okay, a client's vital signs are temp 99, pulse 98, respirations 14, BP 160/90. Which prescription would the nurse expect to hold? Okay, so this is it says, does it have a negative focus? Well, this is negative because of the vital signs, we're having to hold a medication, right? So keywords are the vital signs. So maybe thinking differently about the question now would be, based on the vital signs, which medication should not be given? Or which should be held?
A,
Okay, so A is already ruled out, right? A narcotic, analgesics are held for respiratory below 12.
Mhm.
Okay, and this is respiratory up here is 14. So A is already an incorrect answer.
mm-hmm.
C, cardiotonics are held for a pulse below 60. Well, that's not the case here. So that's an incorrect answer. Okay, so we're down to B and D.
Gonna be B.
For what reason?
They don't have a high enough temperature.
Exactly. Correct. Temperature's 99. And that's the right answer. Right? It's administered for a fever, but not generally for a low-grade fever of 99. So good. So that's half of the questions. You can go through the rest. Okay, we've got 5 minutes left for my group. Just make sure you do your, are there questions I'd have to go back and look. Are there questions for our attestation this week? My group, you guys can look. Well, everybody's group, actually, everybody. Somebody go to week 10 attestation. Are there questions? I didn't look that far ahead.
Yes, there are questions.
What are the questions? Everybody pull up their week 10 attestation. Let's get that done.
What are the 5 types of services covered by Medicaid? Is number 1.
Okay, does anybody have an answer to that? would have to go back into the book and get that. Anybody have the book open that can go look in our, go look in that chapter and get the answers so that we can complete this. Otherwise, you can do your attestation on your own. That's fine. Just making sure you do it within 24 hours. What's the second question? Anybody?
What do you consider a public health concern that needs to be addressed and why?
Okay. You know, I'll let you guys do your
Yeah.
Go ahead. I'll let you do your attestation on your own. Just make sure. Don't forget to do it. I'll remind you, but I really want to do a quick assessment of this review session. How has it been? Too much information? Too little information? Just give me your assessment of this. Have you learned how to study differently going towards this HESI? Give me some feedback, please.
I think it's a lot of great information and a lot of great resources. It just the times of being able to have the time to really use the resources that you're handing to us but it's a lot of great information.
I
Being
agree. It's
able
been
to-
a good review.
Being able to break down the questions and figure out exactly what they're asking and how they're asking has been very helpful.
Okay. So Jennifer, you should go back and keep going with those questions. All right, get through all of them. I think we only got through half. Christine, did you have a question? You're on mute. Christina, you're.
Sorry, let me switch. Yeah, I had a question earlier, and it was when we were going through everything on the child development, and you hit on that topic, and I just want to make sure I've got the hepatovax B allergy. We referenced the allergic reaction. Is that what you're wanting us to know? I mean,
Yeah.
more on that, just kind of like how, okay.
There was a question that asked about, I think there was a question that surrounded what does an allergic reaction look like? So I don't know if they were asking for signs and symptoms or I think that's what, I think they were asking about that. What does an allergic reaction look like?
Okay, because I know our med-surg days on like respiratory distress and those. I mean, I'm recalling that. I just want to make sure I'm in the right wheelhouse for that answer.
Yep,
So,
I think
okay.
yes, you are. You are.
Okay, great, thank you.
And again, I don't know the specific questions that were all in the HESI. I just know the topics they addressed, and that was the trend sheet that we did.
That was very helpful. Yes, thank you. It does kind of guide us in the direction and make sure that we're on task. So that was very, very helpful. Thank you.
You're welcome. You're welcome. Any other feedback from anybody? Okay, well, that ends the review. For my group, for everybody's group, I hope you can get to some more reviews this week to see how other instructors are providing this information. All the information, again, should be the same. It's just different modes of delivery and different resource tools. And again, I'm not sure what Professor Price is using in her review, but I know, like I said, I know Professor Apple is using the PowerPoint she did, which is a summary of the whole study guide. So that might be helpful to some people that are visual learners. They're always nice and pretty, and she has lots of pictures, and it's really great. So, okay, well, thanks for participating. I'll stay on if any, I'm going to stop recording, but I'll stay on if anybody